Antibody, Bartonella. This test may also be known as bacillary angiomatosis, BA, or bacillary peliosis, BP, antibody. The specimen is serum. Methods include enzyme immunoassay, EIA, and indirect fluorescence antibody test. Antibody, Blastomyces. This test is commonly ordered as Anti Blastomyces or Blastomyces antibody titer. It may occasionally be ordered as blasto titer. The specimen is serum. The methods are complement fixation, CF, immunodiffusion, agglutination assay, immunofluorescence, enzyme-linked immunosorbent assay, ELISA, and Western blot, immunoblot. Antibody, Bordetella. This test may be ordered as Pertussis or whooping cough antibody. Blood specimen is serum. Methods include enzyme-linked immunosorbent assay, ELISA, microhemagglutination, complement fixation, CF, and toxin neutralization. Antibody, Borrelia burgdorferi, Lyme disease, confirmatory test, e.g., Western blot or immunoblot. This test may be ordered as a Lyme disease confirmation test. Blood specimen is serum. This test reports a second test for confirmation by immunoblot or Western blot. Antibody, Borrelia burgdorferi, Lyme disease. This test may be ordered simply as a Lyme disease antibody test. Blood specimen is serum. Methods include enzyme-linked immunosorbent assay, ELISA, enzyme immunoassay, EIA, indirect fluorescent antibody, IFA, or specific IgG, IgM, and IgA by antibody capture. Antibody, Borrelia, relapsing fever. This test may be ordered as a relapsing fever antibody. Blood specimen is serum. Antibody, Brucella. Antibody, Campylobacter. Blood specimen is serum. Standard tube agglutination method is common. Antibody, Candida. Blood specimen is serum. Methods include latex agglutination, LA, immunodiffusion, ID, crossed, two-dimensional, immunoelectrophoresis, and enzyme-linked immunosorbent assay, ELISA. Antibody, chlamydia. This test may be ordered as chlamydia psittaci or LVG titer. Methods are complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, and immunofluorescent antibody, IFA. Antibody, chlamydia, IgM. This test may be ordered as chlamydia IgM titer. The specimen is serum or finger stick in adults, or heel stick in infants. Complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, and immunofluorescent antibody, IFA, are methods commonly used. Antibody, coccidioides. This test may be ordered as coccidioides titer, coccidioides antibody titer, cocci titer, or cocci precipitans. The specimen is serum or finger stick in adults, or heel stick in infants. Methods include complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, immunofluorescent antibody, IFA, immunodiffusion, and precipitin test. Antibody, Coxiella burnetii, Q fever. This test may be ordered as Q fever titer, Q fever antibody titer, or C. brunetti titer. The specimen is serum. Methods are complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, immunofluorescent antibody, IFA, immunodiffusion or indirect hemagglutination, IHA. Antibody, Cryptococcus. This test may be ordered as a Cryptococcus antibody titer, or cryptococcosis. The specimen is serum. Methods are complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, and immunofluorescent antibody, IFA. Antibody, cytomegalovirus, CMV. Antibody, cytomegalovirus, CMV, IgM. This test may be ordered as CMV-IFA, CMV titers, cytomegalic inclusion titers, or CMV-IgG. The specimen is serum. Methods are complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, immunofluorescent antibody, IFA, and latex agglutination. Antibody, diphtheria. This test may be ordered as diphtheria antibody titer, or DPT titer. The specimen is serum. Methods are complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, immunofluorescent antibody, IFA, and latex agglutination. Antibody, encephalitis, California, La Crosse. Antibody, encephalitis, Eastern equine. This test may be ordered as La Crosse virus titer, California encephalitis titer, or bunyavirus titer. The specimen is serum. Methods are complement fixation, CF, or enzyme-linked immunosorbent assay, ELISA. Antibody, encephalitis, St. Louis. Antibody, encephalitis, Western equine. This test may be ordered as St. Louis virus titer or St. Louis encephalitis titer. The specimen is serum. Methods are complement fixation, CF, or enzyme-linked immunosorbent assay, ELISA. Antibody, enterovirus, e.g., Coxsackie, echo, polio. This test may be ordered as enterovirus antibody panel, IgG or IgM, Coxsackie A titer, or poliovirus titer. Methods are complement fixation, CF, viral neutralization or enzyme-linked immunosorbent assay, ELISA. Antibody Epstein-Barr, EB, virus, early antigen, EA. Nuclear antigen, EBNA. Viral capsid, VCA. These tests may be ordered as EBVEA titer, EBNA, IgG or IgM, titer, or EBV.VCA, IgG or IgM, or EBVCA, IgG or IgM, titer. The specimen is serum. Methods are complement fixation, CF, or enzyme-linked immunosorbent assay, ELISA, indirect fluorescent antibody, or immunofluorescent antibody, IFA. Antibody, Ehrlichia. This test may also be ordered as Ehrlichia IgM or IgG. The specimen is serum. Methods include indirect fluorescent antibody, IFA, and immunofluorescent antibody, IFA. Antibody, Francisella tularensis. This test is also known as tularemia antibody titer, rabbit fever antibodies, and Francisella tularensis antibodies. The specimen is serum. Methods include complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, or immunofluorescent antibody, IFA, agglutination, and hemagglutination. Antibody, fungus, not elsewhere specified. Blood specimen is serum. Methods are varied and may include complement fixation, CF, immunodiffusion, latex agglutination, LA, immunofluorescence, Western blot, immunoblot, crossed, two-dimensional, immunoelectrophoresis, and enzyme-linked immunosorbent assay, ELISA. Antibody, Giardia lamblia. This test may be requested as Giardia antibody or Giardia titer. Blood specimen is serum. Methods such as commercial kit, enzyme immunoassay, EIA, and indirect immunofluorescence may be employed. Antibody, Helicobacter pylori. This test may be ordered as H. pylori antibody titer or Campylobacter pylori serology. The specimen is serum. Method is enzyme-linked immunosorbent assay, ELISA, or chemiluminescence. Antibody, Helminth, not elsewhere specified. Blood specimen is serum. Methods may include enzyme immunoassay, EIA, and bentonite flocculation. Antibody, Haemophilus influenza. This test may be ordered as AH influenza, type AORB, antibody titer. The specimen is serum. Method is complement fixation, EIA, or enzyme-linked immunosorbent assay, ELISA. Antibody, HTLVI. Antibody, HTLV2. Antibody, HTLV or HIV antibody, confirmatory test, e.g., Western blot. This test is commonly ordered as HTLVI antibody titer or human T-cell leukemia I virus titer. The specimen is by venipuncture or finger stick in adults, or heel stick in infants. Methods are Western blot, radioimmunoprecipitation, and screen enzyme immunoassay. Antibody, hepatitis, delta agent. This test may be ordered as hepatitis D antibody, hepatitis delta antibody, or superinfection antibody. Specimen is serum. Methodology may involve enzyme immunoassay, EIA. Antibody herpes simplex, nonspecific type test. 86,695 type 1. 86,696 type 2. These tests may be ordered as HSV antibody titer, or HSV IgG/IgM. The specimen is serum or finger stick in adults, or heel stick in infants. A number of methodologies have been employed, such as complement fixation, CF, enzyme-linked immunosorbent assay, ELISA, indirect fluorescent antibody, IFA, enzyme immunoassay, and latex. Antibody, histoplasma. This test may be requested as histoplasma antibody. Blood specimen is serum. Complement fixation, CF, is quantifiable and is considered one of the best methods. Immunodiffusion, ID, agar diffusion, latex agglutination, LA, radioimmunoassay, RIA, or enzyme immunoassay, EIA, may also be used. Antibody, HIV-1. Antibody, HIV-1 and HIV-2, single result. Antibody, HIV-2. This test may be ordered as an HIV serological test, an HIV-1 antibody, HIV-1 and -2 serological or a combined HIV-1 and -2 antibody. Blood specimen is serum. Methodology is enzyme immunoassay, EIA, enzyme-linked immunosorbent assay, ELISA, radioimmunoprecipitation assay, RIPA, or indirect fluorescent antibody, IFA.